Good morning. Thank you for being here. Welcome to the third Transgender in Latin America Symposium, organized by Fundación Huésped together with ATTA, LACTRANS, with the support of VIV. It's an honor to be here today with Nadir Cardozo to share this program with you. Fundación Huésped is a leading domestic organization with regional and international presence. We work in the areas of public health from a human rights point of view, focusing on HIV/AIDS, other communicable diseases, and sexual and reproductive health. Our value proposition includes advocacy work, capacity building, direct services, and working with quality, proximity, and transparency. We started working with transgender women in 2010 when we realized that there was a high prevalence rate of HIV in Argentina. This was later replicated in other countries, and starting in 2012, we launched a comprehensive program focusing early on risk and vulnerability assessment for HIV and STIs, and we realized that these programs should be focused on the human being. We should think of people who could be positive or negative, and we thought that we had supplied them with services. That's why we developed this testing, incidence, prophylaxis, and retention in preventive care programs. But due to the high prevalence, 34%, we launched programs that would assess disease burden, possible treatments, interventions to improve retention and adherence, and the restarting of treatment after interruption. As time went by, we realized it was necessary to have a core made up of programs that would include gender affirmation policies, the ones that improve quality of life for these people, as well as adherence and retention. Why do we organize these symposia? Because they are useful for us and participants in the programs to understand what the needs of the population are, what the knowledge gaps are, to learn how to improve the models so as to be able to gather the missing information. This would not have been possible if we had not engaged Nadir early on in the project. She later on engaged this whole group of peer promoters who were involved in the design and implementation of our trials, which included over 850 individuals in several clinical trials. Welcome, Nadir. Thank you for being here with us. The floor is yours. Hello, everybody. I would like to share with you our experience. I am a representative of ATTA, the Association of Transvestite, Transsexual, and Transgender People in Argentina. In 2015, I joined the Fundación Huésped team as a human rights and health care promoter. I was going to be the liaison between my community, the trans community, and the healthcare team. I had to talk to my sisters, to tell them, to share with them what we wanted to do, what our concerns were regarding the population. That's how I started working with them. Well, this joint work with ATTA, Nadir, and the peer promoters team enabled us to produce 19 scientific papers, 27 oral presentations, and 35 posters at congresses, which can be found in our website, and which were possible thanks to the funding from several organizations. What we found out in our research was the high psychosocial vulnerability of these women. 32% only completed high school, 42% live in unstable conditions, 84% were active sex workers, 79% had been arrested at least once. women who are receiving HIV treatment, well, 50% had depression symptoms, 38% suicidal attempts, 52% substance abuse, and 47% had suffered physical and sexual violence. These data have an impact on the health results and show the need to introduce structural changes to improve the life of people so as to later on be able to improve the healthcare results. Regarding access to the healthcare system, this survey showed that 41% of transgender women tried not to go to healthcare centers because they were discriminated by healthcare workers, by other patients, or because of police stigma and violence. So Nadir, please tell us about the stigma in healthcare centers and how trans hotels and trans ethics trials helped us to understand where we should focus. Well, as you know, barriers for access to healthcare, stigma, discrimination that affect us. Well, stigma, when people say that we are not concerned about our health care, that we have substance abuse issues, that we are prostitutes, that we don't care about anything. This plus the discrimination we face when we reach the healthcare system from the moment we entered the sites, discrimination by security people and office staff. Well, because of this, several times our sisters didn't want to go to the hospital. So when they made it to the hospital, it was too late and nothing could be done. So these trials are very important. Trans hotels trial, this is a qualitative and quantitative analysis to find out about the needs and requirements of the trans population. Although in this case, I could not have been present because the team of psychologists had been able to work with one hotel. It wasn't easy for them to get to two other hotels where our sisters didn't want to talk to them because they mistrusted the healthcare system. Later on, I participated in a project, the one I always talk about. This is the Trans Ethics Trial, which dealt with ethics of physicians if they had given information to my sisters who were receiving antiretroviral treatments. I carried out a survey among 25 sisters. I was surprised when 23 of them told me they didn't know what viral load was, why they were taking ARVs, what PrEP was. Only two of them had the necessary information because they were working with civil society organizations. This showed us how much had to be done and the need to have peer promoters to improve communication between the healthcare teams and the trans community. Great. We also realized that there were many missed opportunities. In the same hospital, 38% of transgender women had never been tested for HIV. That's why it was important to work jointly within the organizations, but it was even more important to work outside and to create new testing opportunities as an entrance gate to healthcare, to build this trust that had disappeared, and through diagnosis, being able to link people who are in the community and don't have access to hospitals so that they would have access to treatments. In this regard, the trans testing and trans AIDS trials were key. For these trials, we would go to different hotels where trans women work to carry out HIV tests and syphilis tests. We found high prevalences of HIV in transgender women, 22%, and in the case of syphilis, 25% prevalence among trans women with a very high incidence. regarding anal HPV and other sexually transmitted infection. Several projects are underway in Fundación Huésped. 80% of the women were positive and 70% had lesions on anal paps. So it was very important to reach these populations at earlier stages and to create safe options for diagnosis and treatment in a positive environment where there is no discrimination. There, we found the opportunity to offer to our population the chance to participate in prophylaxis and vaccine trials. Right now, we are carrying out the HPTVN cabotegravir trial, with, which will share very important results in the area of prevention, and the Mosaic trial, which unfortunately, because of the COVID pandemic, is sort of delayed. It is the third vaccine trial in many years in Argentina, and I hope we will be able to make progress to have more therapeutic tools. When we talk about antiretroviral treatment, we talk about the need to have an early diagnosis and to start treatment with ARVs early, ideally on the very same day. For this, we need the tools to be able to keep the women in a follow-up process and with good adherence. In, in the Transviv study, we were able to find out that among women who had enrolled in the study, although the adherence rates and retention rates were 75%, quite high, 25% had dropped out or had stopped the treatments, and those who suffered from anxiety, depression, stigma because of their gender had among these women there was a high correlation with losing women to the treatment. So that's why we believe it's necessary to provide comprehensive treatment and care so as to be able to have good retention rates. I was paying attention to what you were saying, and I believe that here, well, because our sisters, when we go out to have tests done, the ones who are positive need to receive care. Those who are negative, well, we need to work with them on prevention, offer PrEP to them, cabotegravir, or what was offered according to the Mosaic trial. We can see that our sisters who are part of Transviv, well, the care was important because without the psychological intervention, we realized that care improved with sensible staff, with peer promoters, because in the past our sisters would mistrust the healthcare system. However, if there was a peer promoter working with them, supporting them was very important. Multidisciplinary teams are key too to provide care to transgender people, acknowledging each person the way he or she expresses their identity. And also putting an end to stigma and discrimination is key. This was key for us. Early on in this project, the retrospective trial had shown only 44% retention after 12 months among women who had started ARVs at a city hospital, and we moved up to 75%. But there is still a gap there. There is 25% of women who had to drop out for some reason. And here we need to provide comprehensive care. We need to create opportunities in the community for trans women, and we need a job quota law. This is a big challenge. We always lose women who have substance abuse issues, who suffer violence, and that's why it's key to have access in all hospitals, not to this care Nadir was describing and which ATTA is trying to provide and to get. Well, besides this care, we need to work on harm reduction and on empowering and strengthening the women so that they are able to face violence and so as to prevent violence situations which they face on an everyday basis. And we should also provide them with tools, or we should also create tools to engage again those who have left the healthcare system. We have been working with staff from the Miami University at the COPA trial that includes a sub trial on trans women, where we see a higher substance abuse rates, which are related to lower adherence to ARV treatments. But was something which was key in the COPA trial is the physician-patient relationship. The need to create a better quality relationship, and they need to give physicians tools because we don't learn this at the university. We should learn how to deal with these populations with respect, with honesty, and working proactively to encourage people or patients to look for better results in healthcare. And there are special techniques and strategies here. We have the motivational interview technique, and the COPA trial suggests that our previous trials had been more effective than the typical adherence workshops which we had been carrying out before that to try and attract the non-adherent population. In the COPA trial, awareness creation among the healthcare professionals. We were able to tell them what was happening to them, what we were living through and facing when we reached hospitals. It was very useful to be able to talk to the healthcare professionals and to tell them what was happening to us, why adherence was low among our sisters. And although the whole trans population is vulnerable, the sisters who stop taking the treatment are extremely vulnerable. So we had to work harder. We peer promoters had to work harder to support them. This was a challenge for all of us to be able to do all this, but we can see the positive results when the healthcare teams and peer promoters work together for the health of my sisters. And we also worked in capacity building. The capacities which are useful should continue in time, though funding may run out. Those projects should continue in time with the good practices in place so that the healthcare results can be seen. It is a huge knowledge gap in the world of trans men. It's very hard to carry out trials. There is little openness to information in healthcare system. There are very few choices for trans men, just like for trans women. So we are also creating visibility for the situation. There are several surveys among 415 trans men. 40% of them have sex, protected sex. Some of them have anal unprotected sex, so they are at risk. 54% are receiving hormone treatment. Only 43% have taken the HIV test, and there is very little information on prevention. This shows the need for the trans male population to be seen as a population that needs information, prevention, and specific strategies. And for these same reasons, the vaccine trial, the Mosaic trial, includes trans men having sex with men as a population at risk, though many trans men don't have sex with men, but we have to acknowledge that some of them may be at risk. This has been the result of the joint work with Nadir and ATTA, and this began to be showcased 3 years ago at the first symposium, which was a way to share what we were doing throughout Latin America. Nadir, well, this was the first symposium which we organized. It was very important. First of all, because it was Spanish speaking, we were able to speak in Spanish, say what we meant. So it was like a turning point because though there were trans representatives from 11 countries in Latin America and the Caribbean, in the LAC network we had been working on a specific project, Trans Women with No Barriers, the fight against transphobia and HIV/AIDS. And here, for the first time, we had a trans male participating. The second symposium, which was on trans health in Latin America and how to improve the healthcare cascade. This was held in Mexico last year. In this case, we began to interact. We showed how the training for healthcare professionals was. We were able to show that there are tools for those people who work with the trans populations, and we also worked on how to improve the healthcare cascade. It was several very interesting, and this was again in Spanish. And today I'm proud to share with you the agenda for the third symposium with top-notch speakers and experts for 3 days. Starting at 6 p.m., we will have very important presentations. On July the 1st, today, we'll have Joel Paleski, who will talk about anal health, trans and cisgender populations living with HIV. After that, we'll have Maria Veiras from Brazil, who will talk about the impact of gender affirmation therapies in trans people. On July the 2nd, the trans men population will be talked about by Benjamin Genoa. And after that, Erika Trejo from Peru will talk about how to educate our community to participate in clinical trials. Finally, on July the 3rd, a sexual health workshop led by Javier Urcade Belog. After that, we'll talk about the challenges of the PSI approach by Paulina Hernandez from Mexico. And finally, a Q&A session, a live session with Luciana, Inés, Marcela, and myself, who will be answering your questions. Thank you very much for joining us. Thank you very much for participating in the symposium. And we invite you to find our Q&A session to ask all the questions you may have or to send an email to Nadir or to myself. I would like to thank all of you for your attention. And as you said, I would like to stress again that we would like you to join us. Will be dealing with very interesting topics that talk about all the needs of a trans population, not only in Latin America and the Caribbean, but all over the world. So we hope to see you there. And as Omar said, we are here to help you. You have our contact information on the screen. If you need additional information, you may write an email and we will be answering your questions.